The United States is a world leader in medical innovation. It is not, however, an innovator when it comes to healthcare access. In America, medical costs keep quality healthcare out of reach for millions. 18% of the US GDP goes to healthcare costs, which is the highest of any high-income country. And yet, when it comes to healthy outcomes, America has some of the highest rates of preventable deaths. And these high costs are not driven by more visits to the doctor. On average, Americans visit their physicians just over 3 times per year, far less frequently than residents of other high-income nations. So what is causing this significant gap between cost and healthy outcomes? For starters, the US is the only high-income country that doesn't provide universal health coverage to its citizens. And private insurance is expensive and comes with additional out-of-pocket costs. Even with employer-subsidized insurance, people often still have trouble paying medical bills and can incur debt. Another reason healthcare costs are high is simply that our prices for goods and services are higher. Administrative and service costs and prices for goods like pharmaceuticals are not regulated in the US in the same way they are in other countries. Take prescription drugs. In the United States, prescription medication prices are set by pharmaceutical companies, often with little oversight. Conversely, in France and the UK, the government negotiates the price according to the clinical value it provides. As a result, the US pays 3.5 times more for branded drugs than any other country. MRIs are another example, where the US price is 42% more than the UK's average cost and 420% more than Australia's. So how can we do this differently? A good first step is ensuring everyone has access to affordable care via universal health coverage, and reducing barriers to care like ensuring paid sick days and growing the healthcare workforce would support the prevention and management of chronic conditions, reducing costs in the long term. A second step is containing costs through things like lowering administrative burdens or standardizing the price of medical care and diagnostics. US legislators can also protect patients. The Inflation Reduction Act and the No Surprises Act work together to make healthcare more affordable by capping costs and preventing price gouging. These efforts can be expanded to increase affordability further. The United States has a long way to go to make healthcare affordable. But by implementing proven cost reduction strategies modeled by other countries, affordable care for all is possible.